Good morning. Thank you so much, Representative Decker, for sharing your story and being with us this morning. My name is Yulia Lapko. I am the Policy and Advocacy Director for March for Moms, and I want to welcome you all this morning for being here. And it's my absolute pleasure to introduce Dr. Dawn Godboldt, who is the Director of Health Equity at the Maven Clinic, which is the world's largest virtual women's and family health clinic. In her previous work, she focused on creating a more equitable healthcare system through federal policy levers and heavily involved herself in drafting and development of critical federal health legislation. Many of these bills we've heard about endlessly in the past couple of years, which include the Black Maternal Health Momnibus Act of 2021 and the COVID-19 Safe Birthing Act. Dr. Godboldt is a movement across the health equity space and has served as a member of the National Quality Forum's Maternal Mortality and Morbidity Committee. She also was part of the Harvard Chan School of Public Health's Adrian Labs Advisory Board for the City's Challenge and Equitable Maternal Health Coalition Steering Committee. She was also on the March of Dimes Health and Human Services Quality Improvement Advisory Team. And prior to joining Maven, she worked in the reproductive justice space and at the National Partnership for Women and Families, where she integrated a reproductive justice framework into the maternal health portfolio. Her previous work examined race differences in mothers' fear in allowing children outside, disparities in the neighborhood factors, and connection between stereotypes, religion, and obesity. She holds a doctorate in sociology from Florida State University and is a McNair Scholar and a fellow in the Op-Ed Project. So welcome, Dawn.
Thank you so much for that introduction. Good morning to our virtual audiences, in-person audiences. I'm Dawn Godboldt, the Director of Health Equity at Maven Clinic, and I want to take a moment and thank the Honorable Representative Becker for standing here unapologetically and speaking truth to the crisis that we are facing. To name racism and misogyny as root causes of the maternal health crisis is what we need in our front lines in the advocacy space to address the crisis. So thank you for that. Everything that you said, I was going through my speech and crossing out lines because you hit on all of the topics. And again, to name it explicitly is how we move this field forward. I am the Director of Health Equity at Maven Clinic. We are the largest virtual clinic for women's health. We offer continuous holistic support for fertility, family building, pregnancy, parenting, pediatrics, and menopause. We offer digital programs that include access to the largest telehealth network in women and families health, care navigation, evidence-based care programs, and financial support. We were founded in 2014 by Kate Ryder, and since then we have partnered with over 350 employers and health plans. Earlier this week, along with announcing our Series E funding, we also reaffirmed our commitments to health equity, in part through sustainable partnership with organizations like yours here today, and our work with Medicaid plans and efforts to bring our care model to people who have been underserved by the traditional healthcare system. This round of funding will allow us to invest even more deeply in our platform-based approach that is closing gaps in care, driving outcomes at scale, and showing up for every family everywhere. At this point, everyone in the room is aware of the ongoing maternal health crisis, that despite spending over $110 billion in infant and maternal health, the United States comes in too far behind our peer nations, in large part because Black women and Indigenous women share the disproportionate impact of 400 years of inequities, resulting in our mommies and our babies dying more often than our white counterparts. We see gaps in access to fertility and family building. Half of the counties in this country don't have appropriate perinatal services. And with the overturning of Roe versus Wade, we know that we must all act now. I joined Maven because I believe that digital health has the ability to address glaring and critical gaps in our healthcare ecosystem. As the Director of Health Equity, my philosophy for care is pretty straightforward. Everyone deserves access to high-quality reproductive health care, regardless of their skin color, their zip code, their sexual identity, or any other social status that might present as a barrier to health care. We use an address, assess, and empower framework to meet our members' needs. Because Maven is an app and we live in your pocket, we are able to more deeply and frequently assess our members' needs, preferences, and knowledge gaps through ongoing in-app data collection. Our digital-first model works alongside in-person care to address member needs and concerns with an on-demand, unlimited access to a best-in-class specialized provider network 24/7. If I pulled my phone out right now and I went onto the app, I could meet with a provider. We usually say within an hour, but honestly, it's about 30 minutes. And this is something that we know that people need. Serving a diverse population in a culturally sensitive way is built into the core of Maven's service model. We actively seek to transform healthcare experiences and to eliminate barriers to high-quality care so that all of our members can achieve their best health outcomes across our family-building platforms. We track and measure outcomes by race to ensure that we are holding ourselves accountable for advancing health equity. We offer over 30 types of providers across 350 subspecialties, and more than 30% of our providers identify as Black or Brown, and 10% as LGBT+. We have specialized care plans that can address social needs and mental health concerns as well as other risk factors. We offer care matching where our members are able to meet with providers who share similar cultural backgrounds or language preferences. And in our risk assessment, we ask our members about the social determinants of health. We want to know about your access to food, transportation, safe housing, because that will allow us to better understand the needs of our members and to serve them appropriately. We have very promising results on the ability to address health disparities with our care model. Earlier this year, our research team presented at ACOG some of our findings. In one study of about 3,000 first-time moms, Black and white, who engaged in our platform, we saw that our Black members were significantly more likely to seek virtual care through Maven. Black members had double the number of virtual appointments and sought more appointments with each provider type across the platform. Close to half of our Black members had an appointment with a doula, and 39% sought care with an OBGYN. The key takeaway here is that there is a clear demand for specialized and culturally humble care among Black birthing people across the company. And it's why alternative care models like Maven and each of you in the room are so important in addressing the ongoing maternal health crisis. And so we're working on multiple fronts to expand our offering of our product. At the beginning of 2021, we launched with Arkansas Blue Cross Blue Shield to offer our maternity program to new and expecting parents. Our maternity product is available at no cost to AR Home, which is Medicaid in Arkansas, and ACA members with Arkansas Blue Cross Shield or Health Advantage coverage. As a part of our work in the Arkansas Medicaid pilot, we tapped into the power of trusted community-based organizations and faith-based groups. On behalf of Maven Clinic and the March for Moms, I want to thank the CBOs who are in the room for the work that you do. We know how important CBOs are. We know that you fill gaps in the healthcare system by providing valuable support to Black communities, Indigenous communities, impoverished communities, and all other communities who have been underserved and under-resourced for far too long. We also acknowledge that the lack of sustainable funding and network access creates a number of operational challenges that hinder your ability to sustain and scale your programs. On the heels of our Medicaid pilot launch, in partnership with March for Moms, we built our Impact for Families program. It was one of my very first projects at Maven. Lanicia and I worked very closely together, and we had the opportunity to dream. What can an advocacy organization and a digital health startup do to amplify the work that community-based organizations are engaged in? After many, many brainstorming Zooms, calls, text messages, emails, even Instagram DMs, we built our program, The Impact for Families, with the goal of supporting CBOs that are improving maternal health outcomes. In the design, Lenicia and I held firm to a central theme. How do we support with humility? Impact is a 12-month program designed to support 2 organizations' unique goals through financial support, technical assistance, and skill support. And the curriculum was developed by asking our CBOs, what do you need from us? When we were clear on shared goals for success, we flew everyone to headquarters in New York for our first summit. We did a full day of targeted strategic planning and workshops. Chocolate Milk Mommies and Black Mamas ATX shared their experiences with our care team because one aspect of health equity is the bidirectional relationship between large institutions and our community-based organizations. And at the end of the day, we communed over dinner and drinks at a very fancy restaurant in I don't even know where were we, Tribeca, Soho, with friends in the space. And it was just a really great, I think, just culmination of months and months of hard work, being able to execute our plan, and then being able to sit and laugh and to continue dreaming together. A little later today, you will hear from our 2022 and 2023 inaugural fellows. Chocolate Milk Mommies is all the way here from Birmingham, Alabama. They specialize in breastfeeding supports, including free appointments with licensed lactation counselors, breast pump rental programs, and virtual mommy meetups. We also have Black Mamas ATX from Austin, Texas, who provide holistic support through pregnancy and postpartum, including free doula services and monthly sister circle support groups. At Maven, we are in the final stages of strategic planning for 2023, and there is a reoccurring theme across 400 plus Maven employees: equity and growth. We are doing the internal work with our systems and structures and our employees. We are continuing to work with Medicaid plans to make sure access to Maven is available beyond employer-based sponsorship. And we are expanding our social impact strategy so that our Impact for Families program can continue to grow and scale. Everyone in the room here today is here because we are advocates. We are committed to keeping this drumbeat going. We know that we can make a change. We know that we can transform our communities, and we know that we can save more lives. Maven Clinic is here in solidarity to amplify the work that each of you are doing, and I sincerely look forward to our continued work together. Thank you.